800-859-0WJR. 800-859-0957. Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa is here to answer your questions. Let's go to Dave from Detroit, who has a question for Dr. Michael Gray. Dave?
Hi, how are you?
Great.
Hi, Dave. How are you?
Pretty good. I was calling. I had a similar question to the last caller about liposuction. In, people that have, large amounts, like they're overweight, 50, 100 pounds, first of all, how intensive is that and what type of procedures? I was going to ask a similar question about cost, too, but I know it varies depending on the situation. But how intensive is that and the recovery and the actual procedure itself when you're dealing with that large amount?
It's not how large you are. I do large volume reductions for people, and I do impose limits on what how much we're going to do at a certain amount of time. But it's a procedure that can be performed, and we reduce fat, and there's no downtime. It feels like a Charlie horse. Now, certainly, the more parts of your body you do, the more Charlie horse you feel. Just like if you were bruised, but there's no downtime. I want you on the treadmill that evening. You have to do lipo. Lipo is the most popular procedure performed in the world, not because it works. It's because there is no downtime. Tummy tucks work, facelifts work, but it doesn't make it popular because there's some recovery that goes with it. It's not so much of a recovery, it's restrictions. But for lipo, there's none. So people can basically do what they want. It's tolerated great. I did mine. People, I've spoke about it on the show before.
Yes, you have.
It's like, you have people have to understand, who would I go to? Am I going to teach my competitors how I want it done because that's the way it should be done? Or, again, it's secretive. Or am I just going to sit back and let them touch me and not like the way it is? I'm not going to do that. So it was really no big deal. I did it on a Friday. I was back to work Saturday. I was in the gym that evening. It's a Charlie horse. No big deal.
800-859-0WJR, 800-859-0957. Let's take this call before we go to break from Steve in North Carolina. Steve, what's your question tonight?
Hey, my name's Steve, calling you from Brevard, North Carolina, catching you on a skip tonight. And my question is, I chronically get these lipomas, which are basically fatty tumors just under the skin. I've had at least 7 removed for cosmetic reasons. Is there anything I can do to prevent these things?
Starve. No, there's nothing you can do about this. As they arise and as they bother you, you have to either remove them by destroying them with the laser. There are options for you, or we have to excise them. Okay, we can also suck them out through a puncture hole. So there's 3 options. Cut it out, you'll get a scar. Suck it out, or blast them away with the laser.
They tell me these are just basically fatty tumors that just, for whatever reason, grow under the skin. Is there any danger associated with them?
In very, very rare instances, less than 1%, they are called liposarcomas. And any cell in the body can turn into a tumor. These are slow-growing, but lethal in time, but it's very, very rare. And it's not something that you should worry about.
Steve, thank you so much for that call from North Carolina, 7:31, and you're listening to The Big Story Special Edition. Coming up, more of your calls with Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. And for more information, you need to visit the website, anewyou.com. Let's head over to the WJR Big 7 Traffic Center and get the latest on the roadways. Here's Peggy Hodge. And welcome back to the Big Story Special Edition. And tonight we welcome Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. He is in studio waiting to take your calls at 800-859-0WJR, 800-859-0957. Let's talk about eyelid surgery, Dr. Gray. Is it better to remove...
Are you looking at mine? You're not looking at mine.
No.
Okay, good.
Is it better to remove or reposition the tissue in the upper eyelid?
Well, what people have to understand is there's many ways to treat a problem. And I feel that the best method to treat the problem is to treat it versus hiding it. And, yes, we can do different things, and basically you have to educate the patient on each of the procedures. They each offer a benefit. It must be right for the patient. This requires a clear understanding of exactly what the procedures offer and then what options does the patient have. We can inject Botox a certain way that can elevate the eyebrows. Now, this is, I do Botox. If you look, you can See, I barely move, but the sides go up,
Yeah.
and it elevates my apex of my brow. And in a male, I would be hesitant to do a brow lift because I don't know what's going to happen with the hairline. And eventually the hairs may recede, and I got to think about this when I'm talking to someone, and it's certainly always someone's choice. So in the future, then you may see the scar, and we were talking about earlier, scars are permanent. You can add volume underneath the eye for the tear trough. That's where the tears roll down under the cheek.
Okay.
But that not necessarily is the issue. Most often not, people see shadowing, and it's not pigment, and it's really the fat bulging over the edge of the bone, and the best treatment for that is actually removing the fat. Eye surgery is tolerated real well, but there's some restrictions. I don't want you straining yourself for about a week, but it doesn't hurt. Upper lid grows, and eventually, you have more skin folding over, and the best treatment of that is to trim, and then there's combinations that your brow droop. That's why you have the upper skin. So all this we have to go over the patient what they want. So there's not one clear answer what's better.
800-859-0WJR, 800-859-0957 if you have a question for Dr. Gray. I want to talk to you about face lifts and neck lifts and eye lifts. A lot of calls about that, a lot of people wanting to know about that, something that people are really interested in.
Well, if it happens to me, I'm doing it. The biggest problem is if you only have so much life to live, and this is medicine, but it's elective medicine. It's not obligatory like you have to take out your gallbladder.
Right.
And it follows the same rules, just that people actually think that they can fix the problem. I have my job because I'm the guy that was trained to fix actually these problems, just like the air conditioning guy fixes the problem with the air conditioner. I don't do that. So, but because it's not obligatory, people don't have to come to me, but eventually they do. If you come later on in life, you only have that much more time to enjoy. And mental torture plays a big role on your health. So all these lifts just involve skin. All we're doing is trying to hide the scar in the natural folds of the body so they're not visible. Some procedures require some visibility of the scars, and other procedures hide very well. So these facelift procedures hide very well around the ear. Eye lifts hide very well in the natural folds of the eye. Neck lifts hide very great behind the ear and in the hairline. And it involves skin. And people don't understand. You touch the cut, it hurts. It's minimal, if any, discomfort. And the people that do these things, that experience these things once, realize that this is not like open heart surgery or taking out your gallbladder. These procedures are tolerated very well. The recoveries are easy. Yes, you may have some swelling. Maybe you have a bruise, but swelling and bruising goes away. And there's really not these big issues that people wonder about when they're going to get the gallbladder out or the colon removed and things like that.
800-859-0WJR, 800-859-0957 if you have a question for Dr. Gray. I want to ask you about the Fraxel treatment that you're offering at the Michigan Cosmetic Surgery Center and Skin Deep Spa.
Yes, we have a lot of lasers, and lasers are basically used to treat the skin, and they can go deep and they can go superficial. Fraxel is the first laser. Remember I was talking about CO2 is confined to the face. Fraxel was the first laser that allowed me to move off the face and actually treat the problems with the body. It works great with the hands. You know how you get older with your hands and pigment in the skin and the changes and the wrinkling. It allows me to treat the hands. It allows me to treat women. They bake in the sun. Their chest becomes all burnt and discolored, wrinkled. And it allows me to treat that. So what it does is it produces a sunburn type appearance of the skin. But while doing that, it treats the problems with uneven pigment, wrinkles, sun damage, texture, scars, and also tightens the skin because we know that heat causes the tissue to tighten. And then there's different degrees of lasers. A woman came into my office the other day. We transferred fat into her hands because as people get older, they lose the fat in their hand, and you can start seeing the tendons through the skin. So we use fat to also restore volume. So not only do we remove the extra skin, we restore volume, we treat the texture of the actual skin as it gets older. And we have lasers that treat the blood vessels that appear on the skin. And all this is tolerated very well.
800-859-0WJR, 800-859-0957. If you have a question for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa, Sue's been waiting patiently from Brownstown. Sue, what's your question tonight for Dr. Gray?
Hi, Dr. Gray.
Hi, how are you?
Hi. My skin is generally very smooth, but I have one section of skin on my arm that I would describe as bumpy skin. It doesn't go away. It's not from cold. It's just always not smooth.
One question: under the arm or on the arm?
Well, this is actually near the elbow, kind of on the underarm.
Okay. Well, it could be psoriasis.
Well, I know it's not that because I have psoriasis in one other place. And this is not anything that's scabby or anything, it's just bumps.
It could be glands that are clogged. It's something that we'd have to look at to see. It's hard to have you describe it and me diagnosis over the phone. Mm-hmm. So that's something that we'd have to see in the office.
Mm-hmm. Okay, thank you.
Thank you, Sue. What about a person, Dr. Gray, who you talked a little bit about the Fraxel treatment. Would that work or help a person who has vitiligo?
Well, no, it's more for pigment that's dark, not restoring pigment.
Okay.
Vitiligo is a disease that attacks the melanocytes, the melanin cells that produce pigment, and not exactly know why it occurs, but Fraxel wouldn't treat that.
Have you treated anyone with vitiligo in the skin deep spot?
Well, we have a medical tattooist, and what we do at times is we tattoo the white spot to the color of the skin.
Okay, and when we were talking about tattoos earlier and stuff, you can remove those, but some are more difficult to remove than others, and I'm sure.
We have a laser. There's laser light has visible light and invisible light, and they all have different wavelengths. Once we develop the technology to pull that specific pure light out of thin air, then we can figure out what it does. And each laser does different things. The MedLight 4 is a laser that's used to treat these pigments that people use for tattoos. And yes, there are pigments that are more difficult to remove than others, but basically the homegrown tattoo that's green and dark, those go away very quickly.
800-859-0WJR, 800-859-0957. Gus the Barber from Monroe is on the line. Gus?
Good evening, Dr. Gray.
How are you?
Fine as a frog hair. If a frog had hair, to be fine. Sir, what I'm getting at is we got married 50 years ago, Sweetest Day.
Congratulations.
That's right.
No,
congratulations.
if she can put up with me, she can put up with anything for 50 years. I weigh 149 pounds. I can still fit my military uniform that I went in the Army with in 1957. I would like her to lose 15 ugly pounds on the backside. She's had 3 children. I know women put on weight when they have kids. And they can also work it back off, like you said.
What do you mean by backside? Are you talking about the buttocks?
You got it, sir.
Okay.
Yep. Fat in the can, I call it.
Well, here's the way. You can't wish fat to go away in a certain area. Even if she diets, you cannot diet a spot away.
Yeah.
So what happens with the population, and you as an individual wouldn't see this because they don't come to you. As a population, the way it works, when you lose weight, it's going to come out of the face and breasts in females first, face in males. You can't spot diet anything, and if you go to the gym and you step on that Stairmaster, stepping aerobics, do lunges, you're going to get bigger.
Okay.
So that's not going to work. If you have a problem, we attack the problem, and what we do is we reduce the fat as a procedure in that spot. Because if that's the only spot that bothers her.
No, she's got the love handles, too.
Well, I mean, we all have a few spots, but I took care of mine. But that's the spot that bothers her. So if you do something like starving yourself, you can't treat that spot by doing that. It's like redecorating your entire house because you don't like the painting. So what we do is we reduce that with external ultrasonic lipo, and then we can hit it with the laser MPX lipo and get even more reduced. Okay, but you'll never go flatter than the muscles and bones. So if her muscles are big because you went to the gym, your muscles are big because you go to the gym.